Okay, so in this video, I'm going to show you how to do lateral hip distraction using the belt. So this was probably one of the most common reasons why I use this belt. It's very good for patients that have hip arthritis, patients coming with low back pain. This can be really helpful for a lot of patients that we see coming into the clinic, okay? So for the hip, what you want to do in this position, Dave, he's in supine, hook lying. I have the leg that we want to work on bent, okay? In the hook lying position, the other leg is straight. All right, and we're gonna set up, I'm gonna be standing from the side here. I have my towel that I'm gonna put on the patient's inner thigh, okay? So I'm gonna use the belt, I'm gonna stand on up. I have the belt here, it's gonna go right around the patient's femur, okay? Make sure that the padding is on your butt, and the towel is gonna go on the inside here, just like every other video, just to make sure that it's comfortable in the patient's skin. Okay, if you do this for 10 minutes, it can be uncomfortable after a while. So having the patient be as comfortable as you can is important to try, one, so they can relax, but two, so you can get a really better mobility throughout this whole treatment. So standing from the side, okay, I have the belt right along the inside here of his groin, and I have one hand stabilizing here on the distal part of the lateral femur, and my other hand is here on the side stabilizing his ilium, all right, his pelvis, so we can really try to isolate the hip. So when you're here, you're gonna do a little push back with your hips, use your body weight, and come back, all right? Lean and back. And it's almost like I'm doing a little bit of a pelvic tilt as I do this, okay? Again, using your body weight to try to get this motion, back and forth. Good, and then what you can do too is you can take the leg, you can lift the leg up as well from this angle, and you can just do distraction in a different kind of range for the hip. So instead of at 45 degrees flexion, now the hip's at 90, and you can do mobilities in this way, okay? Bring it back down, little mobs. Okay, and so from this angle, you can see mobilizing here, all right? Take the leg. So now I have the leg up, and what I can do here, I have one arm supporting the leg, my other hand is here by the pelvis, shifting, and you can do rotations here. So I'm just doing some distraction with external rotation here, push back, rotate. You can also stabilize here. I will do a little distraction, and I can also work this way with two hands for the ER if doing the other way is too hard, okay? Coming back, rotating. And if you want to work on IR, internal rotation, distraction, gently bring the foot out. Distraction, bring the foot out. And again, if you're comfortable, you can hold distraction and do it this way. Okay, that's to achieve external and internal rotation. And the other one that I use a lot here is for flexion. So I'll do some distraction and some flexion with movement. Pull, lean, really use your body weight, right? That's why we have the belt. Pull and mobilize, okay? And even just some distractions from this side will be helpful. So give that a shot and let me know what you think.